Good morning, afternoon, evening to everyone from all over the world who are joining us in this webinar. We are really delighted to be here today. This series, Looking Back, Looking Forward, was an idea that I had been having for a while of taking the Safe Cities for Women movement, which really we look at as a movement now, and understand the narratives that have been built around it, how it has grown over the past 30 years. It's a 30-year-old movement. It's very much located in the women's movement, but also in many grassroots movements, urban movements, looking at issues of informality, work, services, governance, and it's sort of really grown. The first one that we had, I just want to share one thing, that Mara Rodriguez will be doing the translation in the chat box into Spanish for all our Spanish viewers. So that's great. We can have Spanish viewers as well for this. So the first webinar we had was a few weeks ago, where we had some of the pioneers of the Safe Cities movement, Ana Falu from Argentina and Carolyn Weitzman from Canada, who began the work in the early 90s around building safer cities, located both within the UN UNIFEM at that time, the Women in Habitat Network, as well as the city of Toronto. So it began with really locating it within local government. I think the growth and the movement and how it has spread to so many more cities globally is going to be the focus of today's webinar, in terms of how have the issues evolved, how have the strategies been deployed. And then we will, of course, also talk about cities, urban spaces, safety, inclusion, services, governance in the context of COVID-19 and a world post-COVID-19. Because in many of our lifetimes, this is one of the biggest kind of events that has transformed our cities, that has transformed the way that we can interact with our urban spaces, which we took for granted. Even with issues of safety, we did take our public spaces for granted, and today we're having to relook at it. And therefore, this is a great opportunity for us to engage with so many people. We have really a stellar set of panelists today, and I'm truly excited to introduce all of them. They are people who have been working for many, many years in their spaces and have moved forward the discourse, the narrative on safe cities. Nomusa Shembe, is from South Africa, the eThekwini municipality, Durban. She is a social development practitioner and works as a senior manager at the Safer Cities unit at eThekwini municipality, Durban. She works for the local government to facilitate social crime prevention strategies and urban safety program, and has been involved in the development of the citywide integrated safety strategy. So this is really interesting. Durban has developed a citywide strategy to address safety. Lizette Soria joins us from New York. She is the Global Policy Specialist at UN Women, and she has over 12 years of policy and research experience on women's safety and mobility in cities across the globe. And she's also worked in Papua New Guinea, in Port Moresby, really developing the Safer Cities program there on the ground. So she has hands-on experience. Sarah Ortiz Escalante is a feminist activist and an urban planner. And she's a member of Collective Punt 6, which is a group of sociologists, planners, and architects based in Barcelona, with 15 years of national and international experience working on including an intersectional feminist perspective in urban planning. So this is really key to have this multi-stakeholder kind of group here. Maite Rodriguez Blandon has been working in social movements beginning during the peace treaties in Guatemala. She's the program coordinator of Fundación Guatemala and is the regional coordinator of the Women and Habitat Network. of Latin America and Caribbean. And both these networks are founders, are members of the Wairu Commission. And she's a facilitator for the Community Practitioners Program in Guatemala. And Lana Finnegan is a community organizer and the co-chair of the CSW Committee for the Latin American Caribbean region for more than 8 years. She's a women's rights advocate and has led the Sistren Theatre Collective, which uses street theater to promote discussion about community safety, highlighting programs on gender-based violence, crime prevention, and HIV/AIDS. She was the co-facilitator of the grassroots tent at the Beijing Fourth World Conference in 1995. And Sunita Dhar, who I go to next, was actually also very much involved in the Beijing conference. She ran the coordination unit in India. She's currently a senior advisor with Jagori Delhi and the co-founder and chair of the South Asia Foundation in India. She has designed multi-stakeholder programs contributing to all knowledge, policy, etc. She served on several committees, is a member of the Civil Society Advisory Group UN Women, and has been working with UN Women Global Safer Cities program. I am Kalpana Vishwanath, and I am the co-founder and CEO of Safetipin. We are the hosts of this webinar series. Just really in 2 minutes, Safetipin is a social enterprise based in India, began in 2013. We have a set of apps and technology platform to collect data, to work with different stakeholders in cities, women on the ground, as well as local government and NGOs and academia, UN, others, to use data as a way to engage governments and stakeholders to make our cities more safe, more inclusive, more walkable, and more accessible for women and for all other vulnerable groups in our city. And with that, I am going to now begin this webinar. As you can see, we have 6 people who will be speaking. I will be the facilitator. I just want to do a few house ground rules. On the right side, right now, only I can be seen. Don't worry, everyone will be seen. I can see someone commenting on that. The Zoom webinar chat on the right side is where you can introduce yourselves, and Mara will be translating. In the middle, at the bottom middle, there's something called Q&A. That is the place to pose your questions to the panelists. We will run through all the speakers, and then we will answer your questions in the Q&A. So please ask your questions only in the Q&A box. I request you. The Zoom webinar chat on the right side is just to hear the translation, to introduce yourselves, to have other kinds of conversations. This is to share material, to share links to your work. All that is, this is really a chance for each one of us to learn and get to know each other also. So with that, I'm going to hand over to Nomusa to begin talking about her work in Durban, in eThekwini. Nomusa will be sharing her screen. I hand over to you, Nomusa.
Oh, thank you, Anna and the team, and thank you to the other panelists. It's an honor and privilege that we are able to participate in this webinar. Looking back, looking forward. It's true that as a team, we embarked on a citywide safety audit with an aim of developing an evidence-based policies for our improved community safety to prevent violence and crime in our city. And this project has been made possible by the support of UN Habitat. I'm going to just give a brief presentation around, give an outline of our presentation around what is in eThekwini context, and also an overview of our safety audit and the findings relating to human safety, as well as the key areas of our strategy. Important also is challenges and our lessons from the COVID-19, as well as our innovations that we have identified. eThekwini as a city is in Durban in South Africa with 3.7 million people, and it has a 51% women, and a third of the population live below the poverty line, and 33% of the household live in formal settlements. We have 3.7 women that are more likely to experience poverty than men. Our unemployment rate sits at 16.5, which is far less than our national average of 29%. However, our crime rate sits at 49 per 100,000 murder rate, and drug and substance abuse is also a major driver in gender-based violence. We are also lucky that we are hosting African Forum on Urban Safety as a project that is actually supported by UN Habitat to implement and demonstrate urban safety in the cities.
Nomusa, you're not very clear, people are saying. Are you sharing your screen? Because we cannot see it right now.
I am sharing the screen.
I think you'll have to press that green button again at the bottom to say it's not being shared. And you're not clear also, so I think you need to speak a little louder, maybe.
Okay, all right.
Okay, Ellen can see your screen. Can everybody see your screen now? No.
Can you see it now?
No.
I'm seeing her.
You have you pressed share screen?
Yes.
Okay, no, it's not.
Okay. Can you see now?
Now it's coming, yes.
Oh, okay. All right. Sorry about that.
Okay.
It's coming.
Okay. I was just giving an overview of our findings in terms of our strategy. We have, in our city, we have undertaken the safety audit, and in designing this audit, we were able to look at the socio-economic development factors, the physical environment, as well as my screen is losing the context.
We can see it, just go ahead, yeah.
Can I go ahead? Okay. We looked at the socio-economic development, we looked at our physical environment, we also look at service delivery mechanisms and how we're positioning our infrastructure. And what we found in our audit is that there were issues that are threatening women's safety, such as road safety, such as poor lighting, unsafe recreational and public open spaces. All these were contributing to unsafe environment for women. But over and above this, there was an issue around drug and substance abuse, which featured prominently as a risk factor, as well as unsafe public transport routes. But it's important that we also identified 5 top victims of crime. And those were women, were children, were tourists, were young people, as well as people that are living in informal settlements. But also we found that insecurity and family violence and conflict, also as well as the lack of safe multifunctional public spaces, were amongst the few risk factors that have to be addressed in our strategy. These risk factors were contributing to women vulnerability, and we found them both at home and also in public spaces. But besides that, there were also risk factors alongside the high-risk groups, and those were found to be not being prioritized by local government, such as the LGBT people, the homeless people, drug users, because these categories of people are still not regarded as funded mandates within local government. However, our strategy focused on effective policing and community safety. It also focused on community involvement in safety. It also focused on targeted social crime prevention, victim support, and breaking the cycle of violence, as well as effective service delivery through environmental design. But lastly, and most importantly, is that we also looked at our strategy having an element around knowledge management, research, and crime mapping. And these are our strategic pillars that are taking us forward in terms of our strategy. It's important that when we were doing our safety audit, we identified perceptions of fear, perceptions of residents around fear of crime. And we found that our female respondents were very scared of theft, they were scared of murder, they were scared of rape, they were very scared of ants that are always found in our communities. But over and above that, they were scared about the loss of family members. What we found important is that in terms of our strategy element in effective policing and community safety, we were creating a stronger collaboration between our South African police services as well as our police services, including our law enforcement agencies, to undertake on crime prevention operations. This also assists us in terms of improving the police visibility. And as a city, we have employed more than 300 law enforcement officers who are deployed in different parts of the city in order to reduce the fear of crime among our city residents as part of our intervention in terms of this strategy.
Now,
However,
Ms.
in terms
Ryan,
of,
can I request you to sort of maybe now answer the second question a little bit? I mean, going forward on the responses in COVID time, because I think we will have to look at time also. Yeah.
so you want me to proceed to the other question?
Yeah, I think the second, yeah, you can just, maybe you can just talk about the challenges and the last slide on the emerging safety strategy and then the COVID challenges. Yeah.
Okay.
Thank you.
The safety strategies that we are focusing on are 6 elements. It's effective policing, which looks at rural and urban contexts and how do we deal with those two, as well as how do we forge and foster partnership with police in those communities. Also, the involvement of communities in safety. We are looking at creation of safety structures and strengthening the existing ones as well, so that they deal with issues of safety in the communities. Targeted social crime prevention, that's where we are looking at the issues that were raised around the people that are actually found to be experiencing a lot of crime in our cities. But the effective service delivery through and through environmental design, we are looking at public space there and urban management, because our public spaces have a potential of creating a lot of crime. Victim support and breaking the cycle of violence are prioritizing social development methods there. Knowledge management, in research, we are doing safety audits, we are working with Safetipin as well in those programs. But the challenges that we are having at this point in time is that during the lockdown, we found that various issues are going to change how we interact with one another. We are changing the environment at home have to be changed, and we require a lot of adaptation. For instance, in the event that a single mother or a single parent gets infected with the virus, and she needs to be quarantined or hospitalized during the lockdown, what then will happen to their children? That's a question that we need to ask. But also, how then do we take care of those children that are left on their own and thus disrupting the family system? In some instances, we have experienced that people are experiencing a lot of violence, and because of the pain of substance abuse or substances like alcohol, most people are experiencing withdrawal symptoms like from smoking or from alcohol or from other drugs that they are using, and this is triggering a lot of gender-based violence. The other part is that there is a lack or limited economic security, which is also compounding this violence that is happening among women. But in the city and working with our various departments, particularly Department of Social Development, they've managed to identify that within this particular period, from the 27th to the 30th, there were about 480 women that have been cases that have been reported at the Tutuzela centers on gender-based violence. And that is a marginal increase compared to the past months. And also what we have found that the social development has assisted in actually funding some of the organizations to expand gender-based violence program at all the Tutuzela centers that are operated by National Prosecuting Authority. They have also increased social work interventions at the crisis care centers that are operated by NGOs, and also looked at the victim-friendly rooms that are operated by SAPS, and social workers have been providing psychosocial support and prevention and awareness programs in those areas. But also it's in line with the new National Strategic Plan on Gender-Based Violence and Femicide that has been launched by the national government. There is also a National Gender-Based Violence Command Center that has a helpline to deal with emergency responses around gender-based violence. The funding of shelters for abused women has also been provided by this department in order to explore also economic opportunities for women and also to improve women independence. And the team of social workers also have been deployed in areas or in some of the offices or locations where there is a high number of domestic violence and gender-based violence in eThekwini. For example, in Umlazi, social workers have been placed there and that are dealing with gender-based violence, as well as in Nanda, Phoenix, and Guamashu. Those are the interventions that the city, in partnership with social development, have actually implemented to ensure that women are protected. But on the other hand, the city has established 12 emergency shelters to accommodate 1,900 homeless people. And out of those, there were 200 beds for shelter for women, which are currently accommodating 174 women.
Namusa, can you share this presentation so people can get more details, since we won't have time to go through all of it? Is that okay? Yeah. So if you can just wind up for now. Also, your voice is not that clear, so people are asking for the presentation if they could have it. So Safetipin will make sure that this is shared to everybody.
Okay. Okay.
Thank you. Yeah.
Okay. Just to give you an indication is that what we have learned from this is that there are challenges that we found that are dealing with issues of inadequate shelters for women, as well as insufficient resources and budgetary constraints are hampering the management, as well as the actual provision of services to women. But also the inability to implement our victim empowerment programs has actually compounded the problem. But what is creating such an issue with the services that are being provided at this point in time is inadequate number of social workers and psychologists that are able to deal with these issues. But the lessons learned is that safety is a gender bias. We have found that that those targeted interventions are critical to improve women's safety, both in public spaces as well as in private spaces. The ban of alcohol during COVID lockdown, has it reduced or increased gender-based violence? We need to do more studies around that. The infrastructure and physical environment, how sensitive is the urban planning and design? That needs to be considered, and that is also talking to the issues of social distancing. We have found that there are too many lessons learned on the need to maintain safety, particularly safety of women, through our transversal management approaches, as well as safety planning and governance. The issue of budgeting is also a critical one that needs to be looked at, especially around women's shelters, as well as reporting on women's safety data. That is what is important for us as a city. And we are hopeful that going forward, we will be able to deliver on the project and on our strategy as we move forward, because we have done a lot of interventions in the city. Hence, we are hoping that our implementation are going to address the issues that we have identified. Thank
Thank you,
you.
Hamza. Thank you so much. I think it's been such a rich presentation. Unfortunately, your voice was cracking a bit. So everyone has been asking for your presentation, which we will share. And I think you brought up the issue of domestic violence increased this period of COVID. I am actually going to move to the other speakers now, so we get a chance to ask questions. I will ask Sarah Ortiz to speak next. About her experience in Barcelona and Spain working with the organization. Thank you.
Hello, everybody. Sorry, Kalpana, I thought I was after.
No,
I
no.
was not prepared. Okay, hello, everybody. Thank you for inviting me. For me, it's such an honor to be here. On one hand, because 10 years ago, I was in Delhi in the Women's Safety Conference where I was able to meet Kalpana and Sunita and learn from all the women that were there and some of the attendees who are I think women who have done a lot of work on that, like Caroline Weisman, hello, and Catherine Travers, and also hello to Ellen from Vancouver. So I work with Colectivo Punsis. We are a non-profit cooperative based in Barcelona of architects, urban planners, and sociologists. And basically, we've been working since 2005 from the last 15 years, mostly locally here in the region of Catalonia and Spain, but also we have done some work in internationally, particularly in Latin America, in helping municipalities, but also women's groups and neighborhood groups to.
Can you be slowly for translation? Sorry, please.
Oh, sorry. Yes. Working also with women's groups and residents groups and neighborhood groups to advocate to include a gender perspective in urban planning. I think Kalpana wanted also me to share why our name. It's kind of a weird name if you are not familiar with the country first Catalonia, and I think it's important to share it in the terms of the story of also planning from a gender perspective here in Catalonia. Our name is Collective Point 6. The point 6 makes reference to one of the laws that was enacted by the government of Catalonia in the year of 2004, a year before we started to work as a collective. That law, it was to provide funding to municipalities that wanted to improve some of their neighborhoods. And it was a very progressive law. It's called the neighborhood law locally. And it was because it started the first urban planning law in the country, not only in Catalonia, but in the whole country of Spain, to include social issues in urban planning policies, because urban planning is very related to architecture and to physical stuff here in this country. And for those municipalities that want to access this funding to improve their neighborhoods, they have to respond to several issues. And point 6 was that they were mandated to include a gender perspective in the design of public spaces and facilities. So at that time, 16 years ago, there were not many planners and architects that knew how to include gender perspective in urban planning. And a lot of the people in municipal governments started to find for ways of how to include that. And part of our work was also to provide advice and accompany some of the municipalities in including that in their neighborhood plans. But I want to say that if that was introduced in the law and then was replicated in other laws in the country, because in Spain and then different regions of Spain, like the Basque Country, Andalusia, currently Valencia, etc., besides Catalonia, the urban planning laws require to include a gender perspective in urban planning and to conduct gender impact assessments for all the projects related with urban planning in the broad sense. And that means mobility projects, safety projects, public space projects, facilities, etc. And if that was enacted, it was not by chance or by serendipity. It was because there was a group of feminist activists that were able to enter also the institutions and pressures from inside to also put this topic in the center of the agenda. And of course, if those activists are arrived there, and I want to make this recognition, is because it's been more than 4 decades of women around the world from different disciplines, and also and mostly from geography, urban planning, and architects, that have been advocating to include a gender perspective in urban planning, because we still live today in cities that are highly focused on homogeneous citizen and mostly men, right? So what we do, briefly, we work from a feminist urban planning perspective. We are open and say open that we use a feminist perspective, and that can be a little bit shocking for some people in some contexts, but that's also part of recognizing the genealogy and who has put these topics at the center of the urban agenda. From this view of feminist urban planning, what we do is also to criticize the way that cities have been planning worldwide, following capitalist, patriarchal, and also colonial mandates, and promoting cities that function around production, consumption, and the accumulation of capital, but forget usually about people's lives. And we see that definitely today in the context of this pandemic and this health crisis. We know that this has been a planning model that has been unsustainable for the life of people and for the life also of nature and all beings in our world. And we see this clear consequence today, but we were already seeing this consequence in relation with the climate crisis, but also the crisis of care that we were already experiencing, but it's even more visible today. So for us, urban or work focus on what does it mean to include a feminist perspective in urban planning, things that have been said for many years, put something as simple but as revolutionary as placing people's everyday life at the center of urban planning and space transformation. That means thinking the spaces beyond production and putting care of people and the domestic and the care activities that allow the reproduction of life at the center of policies. But it also means make visible the contributions of women as city builders, and promote women's participation, and also participation with an intersectional perspective. We do a lot of work through participatory processes, and our view of urban planning is that the people who are experts of the territories are the people who inhabit those territories, those neighborhoods, those cities. So without their participation, we cannot be making planning transformations that really improve the needs of people. And finally, and the topic that is also focus of today, feminist urban planning also means to understand what elements condition women's right to the city, and makes us experience the city different. And one of it is gender violence, definitely, how it limits our access to the city, to the spaces, to mobility, infrastructures, etc. But also care, that women still are the caretakers of the world in most of the contexts. So it's necessary also to think how we can transform spaces in order to respond to that. So what have been doing during these 15 years? We've been working and applying this perspective in public space transformations, and also in mobility policies, in housing processes, and also in safety issues from a view of the participation of women. Through the knowledge that we have accumulated years, we also have been able to publish different guides with the methods that we use to include a gender perspective in planning. And I think that learning from many of the women that are here today and that have been working on that for many years, even though we still are in a very unsafe world and unfair world for women, I think we have made a lot of progress today, and there are more and more people and more municipalities that are willing to change the way they do urban planning, more people that are interested in including this feminist intersectional perspective in urban planning around the world. And it's a question that has, it's an interest of the local level, but also the regional, the national, and the international level. And we see that in legislation. And thanks also to the advocacy of women's group, we see it in the new urban agenda. It's not something marginal, it's something that has to be central. We've learning from all the women in Canada, in India, in Latin America. We have also worked on safety issues in our context in Catalonia and apply some of the principles of women's safety in our work. And as example, in the last 4 years, we have conducted more than 40 safety audits through exploratory works over Catalonia in different municipalities, from more rural areas to more urban areas, big cities, small cities, etc. Above all, trying to respond to sexual violence in public spaces, and also in relation also to party and leisure places, and doing a lot of work with young women. And more recently, one of the areas that is very interesting in terms of policy in this issue in Catalonia is all the area of mobility and transportation. And we have been able also to conduct safety audits with in public transportation, in particularly with the public railway company here in Catalonia, where last year we conducted a safety audit in 4 stations, and they are taking the results and applying it to improve the perception of safety in the system. And currently also kind of like the government of Catalonia is more open to include this perspective in mobility. So we are also working in mainstreaming a gender perspective in mobility plans at the regional level. And I think I'll stop here, Kalpana, and we can continue later.
Yeah, there are questions, so you'll all get a chance to speak again.
Perfect.
I'm going to now go to Maite. And Maite from Guatemala will talk about her work. And then we'll have Lana, and then we'll have Lizette before we go to the questions. And then Sunita will do a wrap up at the end, just to give everybody the lay of the land. Thank you.
Thanks, Kalpana. And I'm so happy to be here today in the morning, here very early morning, and sharing with this excellent group of leaders in the safety movement, as you said. I'm happy to hear first Sarah, because this is something that we can say like, you can start building safety from one perspective, but I'm gonna give you the context of this side of the country, of this side of the world, Latin America. And I have to say first that, you know, like Guatemala was involved in 36 years of the Civil War. So in that case, we just started to have like some kind of process to rebuild human rights. And from that perspective, we started to build women's human rights. We have like a population of almost 17 million people, but we know that is not true, because the last exercise of the census was 2 years ago, something like that here, after probably 20 years that we didn't have some kind of this census to measure, you know, like the population. And we understood that this is not a right report from that exercise. So we know we are almost this amount of millions of people, but also we know that women are the majority in this country, in Guatemala. And we know that we have a majority of indigenous population, mostly Mayan population. So in that case, I want to just referring to Sarah's, that is so nice when you are coming from, I think, a democracy, or coming from a country where you have your human rights in one way, safe, you know, like you have this kind of process ongoing. For Latin America and for Central America and for Guatemala, the topic of women's rights is very linked to political participation of women. I think I have to tell that there's another dimension related to women's rights here, violence. So in this case, we can talk about gender-based violence, public violence, economic and social violence. And we need to define a model that can integrate the 3 approaches. For one side, the approach of women's human rights. For one other side, the political participation of women, and by different kinds of violence that are affecting life of women, girls, men, young youth. And in that sense, we can really think about how to reach a model on safety in Latin America, not working in an isolation of one topic to the other. That's why we started to work in Guatemala in 2008, the regional program on Safer Cities for All, Safer Cities with Women. This was conducted mostly by the Women and Habitat Network of Latin America in that time. And we were trying to implement an approach on promoting women's rights in order to prevent different types or kinds of violences through a political participation of women. That was what our main input and process. We were, we need to talk about political participation not only when women are trying to run for an election. We are trying to build citizenship in this kind of context, like when you are emerging from the clandestinity in some of the countries that we were facing in Latin America and Central America, to be in the civil world. I mean, like how to build all this kind of integration. Grassroots women leaders has been very, very key in this process, because some of our organizations now in place as civil organizations in Guatemala were working and operating from the exile. And this is something that we need to understand and recognize, that they were building a lot of programs and processes in the refugee camps. So it was so, so easy for us to start working on safety here, because they were used to have a very different and complicated context where they were trying to get agendas for social partnership or social participation on that. We need to create strong and solid partnerships, because we need to create consensus and bring concerns about safety and eradication of violence and promote women's empowerment. We have to be able to get these kind of concerns and needs for women to the local agendas and the local governments and national governments. We work in Guatemala City, but also we have an intervention, a very clear and like a concrete intervention in one community, in one city at the Caribbean area of Guatemala. We were trying to find the balance and to create really a model that can be saying that you can be part of the Safer Cities movement. Guatemala City, with all the infrastructure, very bad public transportation, I have to say that, Sarah, very bad public spaces approach, but also in a small community, isolated from all the kinds of development, like a ranch or whatever. And we were trying to develop some kind of a bottom-up approach to create advocacy with the local governments. But there's something very important to say. We need to strengthen women's organizations, feminist organizations in our countries, in order to promote a very, very real advocacy programs and processes. That's why we were conducting safety audits in the community, in the cities. We were conducting women's human rights festivals, because we wanted to create and raise awareness about women's rights in this country. And because then we understood only a limited, a number of leaders knows about women's human rights. If you go deep in the population, there's something that they are not aware of that. So we were creating and designing agendas for cities free of violence. We were recently developing the agenda for the right to the city for women. And we were also implementing we are implementing the new urban agenda. Happy that grassroots women leaders movement here were very able to build and to contribute to the new urban agenda. This is something very new in our contexts. We also were working in land management plans. As you said, Sarah and Nemusa, it's important to find some urban planning. But if you are not connected to the municipalities' land management plans, this is something that is going to be very hard for you. So we have to see that our Safer Cities model is based on exploratory and on the territory. You have to walk the territory. You have to go from one side to the other side, recognize public spaces. Then you need to work on advocacy level. You need to create structures like the women's desk inside the district governments, inside municipalities, but then you need to go forward on the land management plans. And this is very useful for us, combining women's human rights and connecting to public space, connecting to all different initiatives and dialogues that we can, intervene. And I'm quite sure that Lana will also debriefing us about different methodologies and tools that grassroots women leaders are using now for establishing the Women's Safer Cities model. The last thing I want to say in this first part of my intervention is how can we say that our work through strengthening organizations is important, because we are working differently with networks. We cannot work isolated. I'm so happy that in this group we have representatives from different institutions, networks, organizations that have been, working from different areas, from different years. I think I came in the Safer Cities community in 2008, through Ana Falou, the founder of Women and Habitat Network of Latin America. But we were trying to see that how this approach was operating in South America, Argentina, Colombia, and Chile, and then how this came to one neighborhood in Lima, in Peru, to Colombia as well, and then how we were able to work on El Salvador and in Central America, trying to say, okay, what is working on the South and what is working on the Central America. So, and this is also we need to be in a global movement. My last reflection on this first intervention is how we need to be connected. I'm connected, with the Indias, with all your magnificent work you are doing there with Safetipin, with Gagori, also with Ponce's, grassroots organization as Groots and Wider Commission. It's different. And now we have been, having a partner in a UN Women. This is so important for all of us, Women and Cities with Catherine. It's so good to have all this global movement to be and to reach really a model on safety for women and girls.
Thank you so much, Maite. I think it's so fascinating to hear their experiences in different parts of the world, and yet some of the experiences are so similar, and yet we also come up with the political situation, the economic situation makes such a difference in the way we have to address it. I will go to Lana because we are running a little bit late on time. So, and I'm not going to speak. Lana, please share your work. It's fascinating the work Lana's been doing in Jamaica.
Good morning, everyone. We, as Sister in Theatre Collective, have been working since 1977, 43 years. We have been using the performing arts as a tool to engage, to advocate, and to get grassroots women to participate into decision making. Working within communities, women have been looking at how it is that they, as women, and grassroots women in particular, can engage their local authorities, engage their government, as well as engage other stakeholders. Since 2009, we have been engaging several communities through using the safety audit tool as a way of looking at how gender-based violence have been impacting on them, as well as crime and violence. And out of that safety audit tool, we were able to engage their local authorities. They were able to engage other government agencies like the Social Development Commission in ensuring that the findings from the safety audit tool was passed over to the local authorities. One of the things I would like to say that the performing arts is a very effective tool in engagement of not just the community women, but the local authorities, because the women were able to use dramatic presentation from the findings of the safety audit, which looks at their finding was around bad roads, street signs, no light, water, zinc fence, sanitary convenience, ownership of land, um, no housing, etc., etc. And they were able to use the performing arts to demonstrate to their local authorities the findings and what have been happening. And through that process, they were able to get a memorandum of understanding with their local authorities. So the women are now sitting on disaster risk management committee in their local authorities. They are sitting on development committees. They are sitting on several committees that would impact their lives. And out of that process, they were able to get light, the street signage. They were able to get proper roads. Zinc fence were down. Now they have access to owning their land, and they have been engaging their authorities in several ways, and we continue to facilitate the process with them. One of the interesting things since the pandemic, COVID-19, is that the women are on the front line. They're the ones out there gathering the data, gathering the information about what is happening to women in their homes. Domestic violence has now been increased. They have gathering that data. They are working. They have been giving the municipality those information. They are also the ones who their councillors and the local authorities have been working with and ensuring that care packages, medication, the elderly, the disabled, single women are taken care of, given those packages, and to ensure that as part of the process, they are seen as the frontline persons on the ground who will ensure that the basic necessities and the basic services continue to be provided to their community and to engage local authorities. As Mighty speaks about political issues, right now in Jamaica, the government that we have is using the pandemic as a campaign tool to ensure, as the women were saying, to win the next election. It's not about ensuring that the, the curfew, etc., are consulted with anybody. The disaster risk management committee that the government have in place is not being headed by ODPEM, which is the organization that deal with disaster risk management. It is the Prime Minister himself who is heading that committee. And the women are concerned. They have raised their concern with their municipalities. And yesterday, there was a tweet that one of the women from NGOs put out and tagged the Prime Minister and the Finance Minister. We were lucky enough that he called and are now asking for a meeting with us as women to start engaging us in discussing how it is that they can deal with curfew, how is it that they can reach women in particular, and to ensure and engage us that they have the right mix and the right way of dealing with women in this pandemic. And when the question and answer, I can expound on other issues if anybody have questions. Thank you, Kampala.
Thank you so much, Lana. I think it's fascinating the use of theater and the use of the performing arts. I think the examples from this group has been great, Namusa using the tools of local government, Sarah as a planner and intervening, Maite, Women in Peace, the Peace Network, the issues that come out of that, and Lana using grassroots and theater in many post-crisis situations. Lizette, now I'm going to uh, ask you to speak about the UN Women Global Safer Cities program, which has grown from 5 cities in 2010, launched in Delhi at the Women's Safety Conference that Sunita and I were privileged to host at that time. And now it's, I hear, 50 cities. Please do share that journey, to share some of your work as well as your reflections in this moment and to follow post-COVID. Thank you.
Thank you, Kalpana, and thank you, everyone. It's a pleasure for me to share this space with these great panelists, inspiring women leading the way. I always say that for man-made solutions, it's always nice to see women-led. For man-made problems, it's good to see women-led solutions. So it's really nice and interesting to hear this panel. Good morning, good afternoon, good evening for all of you. We have seen that we are a lot of participants from all over the world. So thank you very much for your time. I know in these tricky times, having the time to listen and to reflect on these issues is really important. So thank you for participating. Quickly going to your question, Kalpana. So the safe cities and safe public spaces for women and girls. The global initiative started in 2010, as you rightly saw, with 5 founding programs. Those included Kigali in Rwanda, New Delhi in India, Cairo in Egypt, Quito in Ecuador, Port Moresby in Papua New Guinea. And we have been going through this journey for the last 10 years. And as you rightly saw as well, we have scaled up the global initiative from 5 cities to 50 cities. I want to just highlight that it's not just the number of cities, but for us it's really important the quality. And because a lot of this work of creating safe and accessible cities and public spaces for women and girls requires time. So it's one thing that I want to highlight. And also a lot of commitment. I think it was Maite who mentioned the importance of partnerships, completely agree. So for the global initiative, it has been all based on partnerships, inclusive partnerships. And these partnerships have been with local governments. Someone mentioned about the importance, for example, of gender desks or gender offices in the municipality level, for sure. They have been a great advocates for this work. We also work with a lot of women rights organizations. Of course, UN Women, we're a human rights organization. So it's important for us to work and empower and support women rights organizations who are actually advocating for these issues in their own cities from their own local experience and felt experience in the city. Also, of course, we work in certain cases with the private sector, who have been also a good ally in certain cases specifically that they have leadership or knowledge on that issue. And of course, we work with the youth organizations, civil society organizations, and someone there was asking men and boys. Yes, we work with men and boys because we are all part of the solution. What has been the experience in the last 10 years? So we started this program because of the existing gaps that we identified 10 years ago. As you said, the movement is for, I would say even 5 decades ago, the movement of women's safety. But we started 10 years ago identifying specific gaps that we wanted to address. And those specific gaps were few evaluations of the issue. We didn't know well what was working, what was not working to create safe and accessible cities for women and girls. 2, we had not much data and understanding of what it means for women to feel safe and access cities and public spaces. Another issue or gap that we wanted to address was to have concrete public policies and interventions on this issue. So 10 years ago, there were some in some cities, that some cities were leading great things, but they were very scattered, and some of them, right? We wanted to have more a global response, a solution, and to have more cities learning from these public policies that they were taking place. So the journey has been, of course, not easy, and also we have seen a lot of good achievements, challenges, as you all have experienced and shared in your own initiatives. I would say you wanted to know like innovative solutions and key results of this journey. Just briefly, I can share with you, I think one of the key achievements it has been to first of all make this issue of safe and accessible cities for women and girls as a public issue. This has been advocated for women themselves. And also because of this, we have been able to integrate it in different sectors at different levels of governance, local, regional, national, and through different sectors that sometimes were not traditional sectors. In the past, we have seen a lot that women's safety issues or women access to the city was always focused either on urban security or the gender desk. We wanted to expand it throughout the whole local governance because it's such a complex issue that requires so many risk factors, protective factors, that we wanted to make it integrative, a comprehensive approach based on evidence. So we have been working with, in certain cities, great initiatives with the housing sector, with the transport sector, with the cultural and sports. So with different sectors, because this is an issue that requires different angles. Another another success I would say is that now we have more evidence and data. It's still a journey, we're still building it, but at least we start having some evidence, some data on what is working, what is not working. Other thing that I think is important to highlight has been these legal and policy frameworks that have been put in place at city level. Some of them have even inspired frameworks at national level to address this issue. So this is also very important for us, how to scale it up to a national level. And coming from a bottom-up perspective, right? And of course, we are always so thankful to the amazing work that women rights organizations have been doing to make this happen, because it's through them, through their experience, through their leadership, through their advocacy, that really a lot of these movements have been put in place in the cities. And also, I must say, and I must thank that there have been also amazing men and boys being part of the movement and working with us and open spaces and discussing this issue, because this is also an issue that has to be addressed from different angles. That's pretty much a nutshell of the global initiative. And just to address your second question about what are the challenges and what are also, I like to focus also on solutions. I know this is a tricky time. But as you rightly saw, even the concept of public space is changing, right, through COVID. So I just want to highlight quickly, like 3 or 4 trends that we are identifying. Also, just to let you know that we just published a policy brief on this issue. So I'm happy to share the link, but you can find it in the UN Women website. A policy brief on how to ensure safe and accessible spaces for women and girls during COVID and beyond the outbreak. But some of the things that we are noticing, some trends and issues that we have to start thinking of how to integrate women's safety in these trends. So one has been the hierarchy of public spaces is changing, right? Because of COVID, ironically, we need to reduce our distance, right? We have to increase the social distance, but we have to reduce our traveling, right? So in this case, what we are seeing is that streets and neighborhoods are getting more importance. People are more staying in their neighborhoods, in their homes, and in some cities, even with all these limitations of access to public spaces, actually the public spaces are getting more attention. Those parks are now being more used. That little store in the corner is now used more because people are staying more in the streets and their neighborhoods. Also, which we have seen, which is interesting, is the repurpose of these public spaces. Some cities have repurposed some of these public spaces to address to the issue, to the emergency. So I think in this concept, we have to think, how do we integrate women's safety principles in this repurpose of public spaces? How do we guarantee that that new bike lane that is being developed in my neighborhood includes women's safety? And I think Sarah rightly said, also thinking of the care economy. How are those bike lanes are improving the mobility of care? How are we making sure that those new upgrades are including the needs of women and girls? Also, another trend that we have seen is that there are new mobility options, as I mentioned. We have seen now cities now are moving towards other alternatives like bikes, and we know that bikes have been an empowering transport for many women and girls throughout the decades. Also, we are seeing new ways of work. Now, with this technology and everything, we have seen that a lot of the work is being online also. But also it's important to know what does it imply for the informal economy, where a lot of women are part of that informal economy in this new context, right? And finally, just as a key trend issue is that how we can better understand the freedom of movement of women and girls across these spaces, right? that division of private and public is not that straightforward, and it's not just a border, you know, like especially with this new understanding of the public spaces, we have seen this freedom of movement of women and girls. How do we ensure and guarantee that freedom of movement in online spaces, in public spaces in the neighborhood, and also in the homes? Also, we have seen a lot of this increase of domestic violence and violence in the public spaces because there are less eyes on the streets. So it's just a food for thought of these trends and issues coming up. And just quickly, because I think I just have 1 minute. So some of the things we're trying to solutions to address this new context is what I said previously, is how to ensure these women's safety principles are used in these new infrastructure upgrades and this repurpose of public spaces. Also, for example, some cities, for example, we saw in Kigali, Rwanda, they are putting different numbers of hand washing facilities to address the sanitation issue of the crisis. That is great. How do we use those facilities to redistribute the care that a lot of women and girls are responsible of collecting that water, right? And if we're going to do that, how do we make sure that those hand washing facilities are placed in a safe space so that women and girls are safe when they collect that water? Also, we have seen the importance of safer communities around. So when we're talking about bystander approaches, for example, we have seen some cities being quite innovative. Like for example, as neighbors in the building, how can we be also there if there's a case of domestic violence? How can we develop these bystander approaches? What are the activities, the protocols that we can do to support? Also in online, how do we as a connected community can provide more support of safe spaces for women and girls in this context? And there are more. So I know we don't have much time, but I just wanted to highlight some of the quick trends and the quick solutions, and to start thinking that now that we're reshaping the public space, how can we ensure women's safety and women's access to services within this new context? Thank you.
Thank you so much, Lizette. So we've had a really, I think, a really rich set of presentations from very different contexts, and Lizette brought it together very well. There have been lots of questions. In the question and answer box, there are some specific questions. So for example, to Nomusa, there is someone's asked about the Johannesburg, where it's also a safe, unsafe city. Has there been any interesting strategies? Maite, to you, there have been some questions about, I don't know if you've all been looking, about the Women Habitat Network. Sarah, to you also, there have been some questions. What are the kind of strategies of the collective Punt? As well as to Lana about how you use art and theater. In addition to, I'm just going to put together, now what I'm going to do is there are a lot of questions. I've put together in them in sort of like boxes, clustered them together. I would like you all to listen to it. And all the speakers will get another 3 minutes to speak, where they can add a few points as well as answer any question that they'd like to answer. And then we will have Sunita. So one issue again was about the men and boys. The issue on COVID, there was two. One is a gender perspective on COVID-19. And secondly, is COVID-19 an opportunity to reimagine cities? I think that's one interesting question that's come. One question was about budget allocations. Will they be changing, and how do we address, how do we get budgets, money into it? Somebody has asked about, what is a women-friendly city? How is it really different from cities otherwise? I think, Sarah, you had begun to speak about it, but maybe you could explain it a bit more. Also, the traveling patterns of women and men move about differently. How does that impact city planning? After COVID, post-COVID, is there going to be an impact on women's mobility? Do we see that women's mobility is going to be affected drastically in some ways? What about the aesthetics of public spaces? Design, graffiti, art, iconography. What should we ask governments to do for us? And finally, what are the criteria for decision makers to determine the efficiency? I think people are asking which Lizette talked about, how do we measure what works? And I think, so broadly, these are the kind of questions that have come up. I'm going to go back to each one of you. Anyone can start. but you will have to speak in 3 minutes. I'm really sorry. It's such a rich panel, but who would like to start and respond to some of the questions?
I will answer my, yeah,
Go
yeah,
ahead,
just just to refer to my question about the improvement of safety for women. I just want to address some of the issues that we were, concerned about responding for COVID-19, as because at the first time we were doing this first response, distributing like kits for disinfection that is linked to the safety for women as well. But more important, we have been raising the fact and raising issues for local governments. I mean, like we did recently, 3 weeks ago, we did the regional panel on the webinar on feminist lectures on cities and territory, inequality in times of the COVID-19. So we were raising 3 different topics that I think are gonna be like responding for some of the questions that has been raised. First of all, we were raising in to have some kind of different public policies, in the sense that the public policy is not only from the local governments or from the national governments. It's also from the donors community, from the international NGOs, from everyone who's working with people. Public policies are for people, and you can design from your own organization these policies. We have to work on the issue of who cares in the city. We have been involved in this crisis of COVID-19 related to elderly, related to disabled. So we need to concrete the need of public policies that solve the problem of unpaid care. The visibility of who cares is very important in our cities. Also related, the second area we are raising is basic services. I think we need to name that. In informal settlements, they are really confronting a very, very great and high risk, like with the lack of water, the lack of sanitation, we need the lack of affordable housing living in this pandemic, and electricity. We were finding that this is a technological area now. Everything changed with COVID. I mean, like we need to understand that times are gonna be different now. Like some of you were saying now, we are gonna be like been traveling less than we were doing before. We have to work from our communities and cities. And also like we were also talking about what is experiencing women, what are experiencing with violence, as some of you were mentioning, yes, sexual violence. This lockdown has increased the extremely violent society we have. So we have feminicide raising up in different countries.
I'm going to have to
the discrimination against the LGBTQ people. So yeah, these are some of the responses. Yes, of Women Habitat Network has been developing during this, and I'm gonna put like that because I have to work also on food security.
And there was one more question before the others answered. It's also the issue of trans women. A couple of questions come about their safety, queer women. So the next person would like to answer. Nomusa, would you like to speak?
Yes.
You all only 3 minutes so that we can, yeah. Okay.
Okay. In our city, we do have a program which is run by some NGOs that we work with, and they've been very instrumental in the national strategy, the newly developed strategy, the national strategy on gender-based violence and femicide. And they've made enormous contributions to ensure that the LGBT as well as women of different orientation are actually catered for. And what we are aware of is that those issues are not yet incorporated into the policy framework of the municipalities. But we do have, as a city, we do have a gender office that deals with issues of gender, particularly around all those factors that are affecting women of different orientation. So we do have partnerships also with various NGOs that work with LGBT and QI. So in our city, it's quite a lot of engagement that is happening. And currently, we are with the Department of Social Development, we are working on the strategy to deal with those issues so that we are able, as a collective to not discriminate, but over and above that, we are working with an organization through the safety audits and multiple networks that are working with LGBT. So basically, our approach is that we should not leave anyone behind, and we should be as inclusive as possible, and we should incorporate in our policy framework gender issues, including those that are differently orientated.
Thank you so much, Namusa. Sarah, would you like to respond to some of the questions?
Yeah, maybe focus a little bit, of course, from my context, and also acknowledging that this is a privileged perspective, right? That we are healthy, we have a house. I'm in Barcelona, but being also in one of the countries that the measures COVID has been more restrict, I want to emphasize how this crisis is also increasing inequalities worldwide, but also here locally in the south of Europe, that we never had like a welfare state, and particularly gender inequalities. Because talking again from our context, the current lockdown has made it schools have been closed, but people has to continue being working outside. So all the care, and assuming that the home is a safer place for everyone, right? And we see in all the world, in all the countries, how calls for gender violence has increased, because the home is not a safe space for women in many cases. But also assuming that women can, that the family can again respond to care, right? To the care of elders, because the elder care homes have been shut down in many cases. Of the authorities have asked families to take their elders home, because it was very unsafe for them to stay in the elder homes, because the governments cut budgets for elder homes many years ago, and we are seeing the consequence now. But also in terms of education, schools have been closed, and kids have been here for 2 months, and they say the schools won't open until September. So that means six months kids being at home. Who's taking care of kids? Again, all these things, that care is again in the hands of the family, and if it's in the hands of the family, it means in the hands of women. So what this crisis is going to mean also for gender equality and for women's rights. And just like a personal experience, I went yesterday to do some observation in public transportation, because we are doing also like an analysis of public transportation from a gender perspective. And what I see outside, when there is not the time for people who are not working outside to go, it's a city that is full of men, and there are very few women. And it's a city that is full of cars and very few people walking or in public transportation. So I'm afraid of what scenario we're gonna have post-COVID if we don't place care, and if we don't pay gender equality, and we don't play women in the decision-making processes, because I think in many countries it still are the men who are making the decisions without thinking of the consequences.
Absolutely. I think you have put all our experiences very succinctly. Lana, are you with us? I know your internet has been coming and going. Would you like to say anything at this point? I think she's not here. I will give Lizette the chance to speak, and we will go back to Lana if she's able to.
Thanks, Kalpan. Just quickly, because I know we're over the time. So I just wanted to say that, yes, it is a tricky time, but some of the cities across the globe, we're going it through a different time, right? Asia went first. Now we are seeing it in Latin America. We're experiencing something different. So we don't have many solutions right now. That's a fact, because we are going through this change. But we do see some starting points of action, and those recommendations, some of the questions were there, you can find in this policy brief. Unfortunately, I cannot go over all the recommendations now, but there are some there. But I just want to keep up that even though it's very challenging, I do agree that it is also fertile ground to reshape and transform these public spaces to create cities more equal and inclusive for all, including women's safety, all these issues that were touched today now, like care, all these issues. It's just for us, and every one of us as a neighbor, as a decision maker, as a driver, what can we do to create and to empower these public spaces that we are all included, and that it's safe for all and accessible for all. So just that one final comment from my side. Thanks.
Thank you so much. I think we have lost Lana. Unfortunately, this technology always does fail us a little bit at the last minute. I hope she still does come back. But I think I would like to now request Sunitha to share her thoughts. I think a lot of ideas have come up, a lot of experiences, a lot of practices, a lot of concerns and challenges from both the panelists as well as the questions that have come up. And I hand over to you, Sunitha, to really give us a perspective on how to move forward.
Thank you, Kalpana. This has been a very exciting conversation. And I think what I've heard, I can't go much into depth because there is a time constraint, but what I have heard is that with a lot of effort, with a lot of investment, feminists have invested into developing the Safe Cities model. And they have ensured the participation of women at the margins, women at the grassroots levels. And I do want to say that includes women are not a homogeneous category, and we are talking about trans, queer, women from the minority communities, women with disabilities, sex workers, domestic workers, women in the informal sector across, and women from ethnic and other minority populations. So the strategies have really been evolved, taking into consideration their lived realities, their perspectives, though it's been a long, long struggle. I also heard about the fact that we are talking very deeply, we are questioning the neoliberal, capitalist, patriarchal model of development. And I think that's very true. Sarah has spoken to it. This is something that we have been arguing about. We have been talking about the fact that this development model is not based on inclusion, on the voices of the majority of the poor in the countries across the world. And we have seen that in the context of COVID, how dispossessed, how badly hit have been those that have been in the informal sector. We've seen it in different degrees across the countries, but we've seen that they had completely fallen out of our policy frame and out of our institutional responses in the current emergency. I also heard about the fact that how women's rights were brought together across different sectors, the politics, the economics, the solidarity. And we also saw how women's unpaid care work, women's labor, was never taken into account, and how that affected women's opportunities and rights. So the intersectorality and the intersectionality of approaches and strategies was something that everybody referred to. And we know today that in the context of COVID, the state has to some extent co-opted women's unpaid work, because in many of the rural tribal areas, it is the women who are running the community kitchens. It is the women who are frontline workers as nurses and health providers. It is the women who are taking the load of taking care of their families, their children, older members, etc. I also heard about, each of us across, in the last 30 years, we've gathered a lot of data. We've looked at what has worked and what hasn't worked. And I think that evidence is available to us. We have to now give it another look. We have to see what is happening. We need a new round of mapping. We need to do a social and agenda audit of all the new policies and intervention models that have come into place in the post-COVID world, and look at, essentially rethink our urban design, our urban services, our public services. We cannot think about privatization as the solution. We have to look at how geographies have to be developed, because we know that the urban commons have disappeared. We know the density within the dense housing models that were developed, as we can see in India, the resettlement colonies, and how most people do not have a room, they do not have a house. And therefore, to keep the social distancing, this physical distancing, is really something that's not relevant to many of the people who live on the margins. I also heard about how policies, budgets, and laws were developed. We know that right now, many of these policies and legal frameworks are in suspended animation, so to speak. And we need to recall them. We need to ensure that our governments are being accountable, are following the commitments that they have made to the communities, to the urban safeties, to services for ending violence against women. We know the kinds of violence that women are facing, not just domestic violence. They're also facing state violence. The kinds of attacks on them by the police and by other vigilante groups is unacceptable in today's times. And we need new protocols to be designed if we need to ensure that people live with dignity and are able to secure some form of well-being in their lives. I also heard about the fact that services today are not really available for women. I mean, because of the lockdown, the helplines may be working, may not be working, shelters are working. In some places, alternatives have been made, but we need to do a lot more in terms of services for violence against women. Right to the city. This is really a fundamental question that needs to be asked again. Who does the city belong to? And I think COVID has shown us the fault lines in society, the structural inequalities, the fact that we have forgotten most people in our society. 90% of them are in the informal sector and today have no money, have no livelihoods, and have no security and social safety nets. And we have to relook at our model of right to the city. I'd also like to talk about the fact that many of the speakers spoke about partnerships, and I think that's the only way to go. Women's groups have always invested into partnerships, working on feminist solidarity principles, on sharing their methodologies across, and working with the state to engender their plans. Today, I'm not sure how much space there is for them to work, and I think we're all struggling to find a foothold to influence local policies, state policies, national policies. However, I know that a lot of open letters and advisories and statements have gone out to women's groups. I know time is limited, so I'm not going to say much more, but then the fact that we need a new form of gender sensitive governance, we need to develop technology platforms for women in these remote geographies to link to each other. We need to ensure that city regional planning makes the connections between the rural and the urban. In the Indian context, we are seeing that migrants have, out of sheer desperation, trying to go home, and they may not return to the cities because of the way that they have been treated. So what is the kind of planning that will be done at the local level for them? And last but not the least, we really need city level gender, age, other variables, disaggregated granular data if we have to replan our cities. And we need to work across citizen groups, the private sector, and all of us. So thank you.
Wonderful. Thank you so much, Sunita. I think you summarized it and expanded and brought it together. There isn't much time, and there's no way to sort of actually summarize such a rich discussion. I want to really thank each one of the panelists. I think you brought out the, I think all of us working, feminists, women's rights activists, whether we're in local government, whether we're in the United Nations, whether we're in academia or grassroots, today we have a very heavy burden on our shoulders. We know that the world is changing in a way, and as Sunita, the word you know, the fault lines in our societies have become very clear. Sarah said that too, the burden has fallen on women. It's not just domestic violence, it's the work of care, it's the worrying about what's going to happen. I mean, if schools are closed for 6 months, what is going to happen to women workers? This is something we know as individual, their burdens, but as a women's movement, as a Safe Cities movement, can we really use this moment to begin to imagine a different future? And I think that is the important question we have to take. As Lizette said, I also like to look at solutions, not only challenges. We're right in the middle of the crisis. We do not know when this crisis is going to end, if it's ever going to end. It will just change its form. But it has brought home inequality in such a stark way. And gender, of course, is one of them, but so many other. And I think class, I think the class inequality in all our cultures, all our societies. And as for us in India, it has been a deeply, deeply disturbing time for us to see migrant workers walking 200, 300 kilometers, reaching their homes and dying. This is not, this is a silent pandemic, as well as the domestic violence, which is another silent pandemic. So, you know, it's, it is difficult to, at some moment, sometimes look forward and see where we're going. But I think the fact that we believe in our work, we believe in partnerships, and the passion with which all of you spoke is something. And the questions that have come from the audience has been fantastic. I can see the engagement, and I can just say that, you know, we will find solutions. We've always done it. Sometimes they're small, sometimes they're large. Sometimes we learn from each other. Sometimes we build on each other's knowledge. And we have a global movement today. We know in some ways, COVID is an urban phenomenon. It has primarily hit cities. It is hitting villages, but that is the next step, and we hope it will not be as damaging. But it's also the nature of cities. And so I'd like to end by saying that, you know, these conversations are what is going to take us forward, where we can learn from each other. I thank all the panelists. I'm really sorry that Lana dropped out. And I thank all the participants for your participation, for your questions, for listening to us for 1.5 hours. I hope it was useful for all of you. Thank you once again. Have a lovely day, afternoon, evening to all of you. We will be having more on this series, looking back, looking forward as the days go by. I think the webinar model is going to stay for a while. So let's use it to talk, to engage, and to communicate with each other. A good day and good evening to all of you. Thank you once again.
Thank you.